Hi, I'm Michelle Snellgross, and I'm your nurse. Your doctor wanted me to come in and talk to you about your child's new diagnosis of asthma. I'd like to explain a little bit about this condition. First, asthma is a condition that affects the airways, which are the tubes that carry the air in and out of your lungs. If you have asthma, your airways sometimes become inflamed or narrowed. This makes it harder for the air to flow in and out when you exhale. For example, it's kind of like having when you have asthma, you're trying to deflate a balloon with a straw, but the straw's pinched off, so all that air gets trapped and unable to get out. Asthma is fairly common in the United States. In fact, the CDC has reported that 1 out of every 13 people has some type of asthma. While there is no cure for asthma, we can manage the symptoms effectively with medications and close monitoring. An asthma attack can be triggered or caused by several things. It can be caused by environmental factors such as pollen, grass, pet dander, tobacco or wood smoke, cleaning products, perfumes, and even scented candles. Asthma also can be triggered by weather, such as breathing cold air during the winter or in the summertime when the humidity is real high. It kind of makes it real hard to breathe. This list seems endless, but it's an example of what could possibly cause your child to flare up. Working with your doctor and paying close attention can determine what does or does not cause an attack. Here are a few common signs of asthma to keep an eye for, watch out for. You'll hear a wheezing or whistling sound. That's the most common sign. That's the one that we hear the most often about. Your child complains about chest tightness or congestion. They may be breathing shallow and fast. They may have a cough, especially at night when the humidity gets high or the barometric pressure drops. Most asthmatic people have a problem at night or early morning. Shortness of breath or hard time catching their breath, like when they've been running real hard and fast for a long time, and so that's the kind of breathing that we're looking for. Some children who have asthma, they feel tired a lot, or they can be irritable for no reason. They just don't feel good, so they're just not happy. Some children that have asthma, you'll notice that they'll have a dark ring around their bottom of their eyes. They have like a raccoon appearance. This is a sign of an allergic reaction or response to something, and it can cause their airways to have a problem. Your child can have one of these signs or more than one of these signs. The important thing is to keep your child calm and reassure them during an attack that they're there to help. Okay, it's very important to act quickly during an asthma attack because it can lead to complications that can be life-threatening. You will need to contact your provider if your child's cough or wheezing does not improve with the medication. If your child has any of these conditions, that the cough doesn't abate, the breathing gets shallow, they're breathing too fast, they're pass out, of course, then you seek emergency care immediately. If the child stops mid-sentence to take a breath or unable to eat due to shortness of breath, or if you notice they're using their tummy muscles to breathe, you can see that the diaphragm is going up underneath the rib cage, then you need to seek emergency care. If your infant has asthma and you notice that the nares, the nostrils, are flared out, or they're not wanting to nurse or suck a bottle, then that could be a sign that they're having some asthma problems, and you need to contact the doctor or go get urgent care, emergency care. There is medications that your provider can prescribe that will help reduce these symptoms. The most common medication to help stop the asthma or the wheezing is albuterol. This can be given by inhaler or a nebulizer. A nebulizer is we put a mask on the child and it's mixed in with some sterile solution, saline, and it mists into their lungs. It's a lot friendlier for kids to do. They have fun with it because they make dragon smoke. Albuterol is a short-acting beta-2 agonist, which means that it's the agent in it is to make it where it dilates or pops open the airways so that the air can move easier from one, through the passages. Some people call these inhalers the rescue inhalers. That's what they call. I need my rescue inhaler. That's what, because the albuterol can help reverse that wheezing very quickly. There's several of these rescue inhaler brands, but they all do the same. Okay, side effects of it: sometimes it can make you feel jittery, it can make you feel shaky, it can make you feel dizzy, and also can give you heart racing feeling. Another type of medication that we use to control asthma is a long-acting beta 2 agonist. The medication is developed to help relax the muscles that line the airways so the air can flow more freely in and out. You may have heard some of these brands on TV: Advair, Breztri, Wixela, Dulera, Ceravent. Um, you've heard those on TV. This is what these do. These are long acting. So in other words, the albuterol will last for about 4 hours. These can last up to 12 hours. So they're more of a maintenance medication. They're not a short, get you out of trouble medication. A lot of these medications are powder based. So instead of you have to suck the powder in, the essential thing you need to remember is to have your child take a sip of water, swish and spit, so that the powder doesn't lay in their mouth and can complications, cause a yeast infection or what we call thrush in the mouth, or have an infection in the mouth. These are inhaled steroids. So your child might get a little bit hyperactive on some children. Some children might get irritability. Some might have slight headaches. It will get better as they get used to the medication. The good news is your child can lead a healthy lifestyle. Okay, we just need to kind of pay attention to their environment and limit exposures. We want to limit their exposures to outside triggers, such as avoiding cold air or humid air conditions. Don't allow smoking near your child, even if you're outside. If someone is smoking near them, remove your child from that area or ask them to move away. Encourage your child to be active so it can help them maintain a healthy weight, and it improves lung functions. And the last thing to remember is to be sure you keep all your scheduled follow-up appointments and wellness visits, and keep your immunizations up to date and current. If you have any questions, just call us here at the office. We're happy to help. And again, thank you for letting me tell you about asthma. If there's anything you need, we have handouts available in printed form, and I do have a chart that tells you about the different inhalers so that you can reference to which one you have and how to use it. Have a good evening. Bye.